Hello, how's it going, folks? And my group will be Will, Cheryl, Francesca, Diana, and I'll be covering, Catherine as well. I'll be covering question 1 and question 8, and at the end of the presentation, there will be a video that I've made. So today that we are talking about elderly abuse, and let's go. Come on, Mouser. What are the unique issues, barriers, and challenges for elderly domestic violence?
Wait. Is that it? Or sorry.
So we've got financially abused. There you go. We've got the gangster grandpa down there.
Grandma.
That's a woman.
So their loved ones would turn against them in return of getting their assets by accessing with their pensions, their money, and forging their paperwork to get on the property name change to them.
Their will and everything.
Yep. I haven't even finished.
Oh, sorry.
There. So they will use different tactics by violating their rules, forcing elders to move out for being useless and using threatened methods. Okay, Panoy. So we have socially abused. So we have the financially abused that controlling with the asset and the money, and for that is going on. They want them to keep a distance away from their families and friends, preventing for them to discuss about their ongoing abuse, which is fear for them to spreading out the abuse. Annoyed? Oh, not against another granny.
You're the one who put this photo.
Okay, so we have like domestic violence. It's a taboo. Like people, when it comes to domestic violence, it's usually families or kids are being affected, but not in the elderly sector. So therefore, victims are shamed and unable to report to speak up. So what? Challenges? So elderly rely on family members, in this scenario the abuser, for transportation. As you guys know, elders, they can't get on public transport. For them, they use their family members to use as a public for transportation. But however, they're also the abuser. So why would they take them to go to a support center for domestic support center for them, for dobbing them in? So that is some challenges for them to go to A to B, to let their domestic violence to be heard. Barriers. So for them, since it's been taboo and they are feared to discuss it with the support center because they might increase with the violence and nothing will get done. Most likely they lose their family members.
The acts of legislation. Identify relevant legislation and acts to refer to when working with a domestic family and violence. The Family Violence Protection Act, Aged Care Act, the Elderly Abuse Hotline that you can contact, that you can contact the local police or find a local aged care assessment team like the Care Center, the Aged Care Information Line. There's no mandatory reporting of the elderly abuse. The legal protections that is available for them is to apply for an intervention order to protect someone from the elderly abuse, which is in the family violence protection.
Alright, so I'm going to give you the strategies. Identifying particular practical strategies. So if you're an elderly person, or if you know somebody that has been abused and they're obviously an elder, you have to talk to somebody. You can talk to a doctor, a friend, a family member who that elderly person can trust. You have to be specific because some elderly people might have a hard time of understanding what you're trying to say. say to them. I think that's what I'm saying as well. And understanding that elders have a right. So elders may have refused to admit that they're being abused because of fear of the caregiver will retaliate or be worried about who will take care of them if their abuser carer is removed. But sadly, elders may view having an abuser taker is better than not having a caregiver. Being forced from out of their home or being in a retirement home. It is safe for you to continue to stay in contact and encourage the elder to consider alternatives to home care. For example, taking tour of access living, other faculties, without being pressured to move or making them to be open to change. Keeping elders and caregivers connected to support services can help reduce feeling of isolation and depression. Family members might be the best chance of convincing elders to consider alternative care. All right, communication skills. Empathy. As a worker, we need to be understanding and accept how they feel. Finding an alternative solution to help and support them, allowing them to make the decision for themselves. Again, they need to express how they feel and we need to accept how they feel as well. Words of encouragement and understanding. Body language. It is important that we have our full attention on them because they might not understand due to possible hearing or slow intake or difficulties understanding. You want them to feel comfortable as possible and allow them to take their time to collect their thoughts, and as a worker we need to be patient with them. So slow in speaking, pause in between topics, and non-threatening physical contact, and avoid person's personal space as well.
I chose the Domestic Violence Victoria Resource Centre. What they do telephone support, information and referral services to assist people who have experienced family violence, supportive online information to help people who have experienced family violence, and training courses for professionals to improve their skills in supporting survivors of violence, a specialist library which provides self-help material and is open to the general public, and they make helpful pamphlets, booklets and websites to assist survivors of family violence. The agency works to achieve these three strategies, which support workforce development in the community sector around family violence, improve the quality of services to victims of violence, inform and support those affected by this violence, inform public policy and research. And the other one I did was the Senior Rights Victoria. At Seniors Right Victoria, the vision is to become a centre of excellence that promotes, empowers and protects and enhances the rights of older people in the prevention of and response to elder abuse and ageism. They do this through delivery of an integrated service response informed by practice excellence. Information that agencies would need. They would need the date of birth, contact number and address, information about the current risk for the client, relevant information about the client history, risk indicators, what services is needed for the client, written or verbal reason for the referral, reports from doctors and other agencies, information for family members, carers. Client may need disability access, interpreter if needed, and may have hearing or visual impairment.
The rights and responsibilities. The rights to confidentiality and privacy, the rights to access the paperwork, the right for legal aid, the right to set their own boundaries and walk out anytime, the right to pick their location, which feels comfortable to them, and the responsibility These are the responsibility to provide the correct paperwork when asked for, the responsibility to get to a meeting on time, the responsibility to the code of conduct, they do not be under the influence of drugs or alcohol, and the responsibility to provide as much accurate information they can.
Oh, it's mine. So what's my response dealing with clients in family, elderly family or elderly violence? So accurate information, of course, you have to do your research, providing accurate information. You don't want the clients getting the false information, looking at the office. Confidentiality, of course, we have to keep it within the organization, and as well can't be really open about it. Do not make any assumption just because based on their looks or their appearance. Can't always just judge by the book of the cover. Also, you have to go details, deep details in, gather information by asking them questions. Advocacy. Gosh, what did I write for that? We're not here to make decisions for clients. We support clients' needs and respect their decisions and referral services. Forcing client, of course we can't force client. Our duty is to stay persistent and let the client be comfortable of sharing their information. And right now I'll be showing you a video. So the video, I know I may not seem as an elderly person, so I'll be playing the elderly, and these girls are the abusers.
When did you do this?
Wait, no, I'm not ready.
And enjoy.
She didn't fold his clothes.
How come there's no volume?
There's no volume.
Why are the blinds going out?
Wait, hold up.
Will, did you say you were the elderly?
Yeah.
Elderly can't use phones.
Well, that's the whole purpose.
Hold up. Technical difficulties at the moment.
Underneath
Okay.
that one, to put them down. Yeah, that's it. Yeah.
I like the lack of volume.
There's no volume, so.
Oh.
So yeah, guys, we got to cancel our video.
It's the last class.
No, keep playing. You just explain what's going on.
Hold up. We're gonna try and open it on another. Really?
It's not that great, so.
Oh, shut up, Will. What the hell?
It's okay, you don't have to look at the video. You can just look at I have the video.
I didn't do this for nothing.
I want to see it.
What are you trying to say?
Turn the volume up.
Oh, hang on. It could be the computer.
Yeah, because I think.
Are you looking at the one?
There you go.
Okay, thank you.
Jahan.
Bye, everybody.
I can see you stand.
Anna, can you please help your gram? Gosh.
Francesca, how do I call Uncle Kim? This bloody phone, look, where is it taking me?
Anna, can you please help your grandpa?
I'm busy.
I said now.
Oh, busy.
What do you want, grandpa?
I want to call Uncle Kim. It's a very important call.
Can I wait?
No, I want it now. You shouldn't talk back to your elders like that.
What do you want?
I need to be calling Uncle Kim for me.
Then why the heck are you on the maps?
I don't know why. This phone is so complicated. You should know that.
Then why did you ask for it?
Because you gave me the phone.
You go here and you type in his number.
Oh, there you go. I found Mr. Kim. What? What is this? No money on my account. Give me some money. What is this, huh?
Excuse me? Does it look like I'm a bank?
Yes, of course. You give me the phone and the number? Of course, you're a bank.
Excuse me, you live here